When a patient visits a physician's office, the patient and the healthcare professional work together through screening, history taking, proper diagnosis, looking at symptoms, and then coming up with a therapy plan. And then what? The patient leaves the office with a prescription in hand. They've heard perhaps some of what the doctor had to say. 32% of the time, that patient will never fill their prescription. Prescription refill rates to manage chronic disease drop off after 6 months. Patients say they can't afford their prescriptions, that perhaps they feel better, they don't like the side effects, or that another healthcare professional has told them to stop, or they simply forgot. It's within this context that we bring you this 4-part video series on patient adherence. This project was funded by an educational grant from Pfizer to explore the needs around patient adherence and the role that education can play in helping physicians and other healthcare professionals address and systematically screen and monitor for patient adherence. According to the National Council on Patient Information and Education, poor medication adherence has reached a crisis proportion in the United States and around the world, leading to unnecessary disease progression, disease complications, reduced functional abilities, lower quality of life, perhaps even premature death. Patient adherence, or the lack of patient adherence, has been estimated to cost approximately $177 billion per year to the U.S. economy, $47 billion each year in drug-related hospitalizations. Adherence contributes to 40% of admissions to nursing home, as well as $2,000 in medical cost per year per patient for physician visits, particularly in chronic disease management. Medication use has increased in the United States over the past few years. Nearly 1/2 of all Americans take more than one prescription medication, and more than half of all older Americans take at least 3 prescription medications. These medications are effective at treating disease, but a significant number of patients don't take them as prescribed or don't take them at all. Non-adherence to medication stems from patient beliefs, fears, obstacles in communication, financial issues, and many other causes, including cost, side effects, and patient attitude. This quote by Dr. Haynes of the Cochrane Collaboration summarizes our imperative. As the prevalence of chronic disease continues to increase, we have to understand the myriad of factors that influence patient adherence and explore the role of patient, physician, and healthcare system in addressing this public health need. Patient adherence is a serious health issue, particularly in chronic disease management. We aren't implying that it doesn't exist in acute disease management, as anyone who has ever run a medication drop will tell you, but adherence is more challenging the longer a patient is on prescribed therapy. Medical education, particularly continuing medical education, has focused on vertical therapy areas, for example, diabetes management, cardiovascular disease management, asthma management. Yet adherence cuts across all these therapy areas. There are nuances in each disease state that impact adherence, but our goal is to look at adherence as it affects all diseases, particularly in chronic disease management. During this project, we learned that adherence is not a great standalone topic for physicians. They aren't interested in a day-long lecture on patient adherence. Therefore, we need to explore adherence within the context of disease management as yet another tool the physician and their healthcare staff can use to improve patient outcomes. As we said before, adherence drives up healthcare costs. Prescriptions remain unused, therapy is modified based on non-response, follow-up visits are scheduled or dropped, and our society is acutely aware and pays the cost for these missed opportunities for treatment. Adherence is a patient safety issue. Patients have doses or double up on them when they forget. Physicians increase doses because they fail to believe that non-adherence is a cause of lack of response to therapy. Word about the terms used throughout this project. While compliance is the most recognized term by physicians, compliance is interpreted as a physician's orders irrespective of the patient's desires. Adherence and the term concordance recognize the partnership that the physician and the patient have in their agreed upon therapy. We use the term adherence throughout this project, recognizing its representation of all the various words. Adherence, however, is not a black and white term, but refers to many shades of gray. Virtually all parents, except perhaps my mother, fail to take their medication at some point. Therefore, we stay away from the term non-adherence and work towards improving adherence. We also talk about persistence, or the length of time that a patient continues to take their medication. There are factors of timing. How often a day does a patient need to take their medications? What other medications or lifestyle adjustments do they need to make in order to find just the right time in their daily function to take their medication? I encourage you to listen to the next 3 chapters as my colleagues talk about the needs assessment that was completed around patient adherence. We discuss what the literature has to say about patient adherence and our analysis of what makes a difference and what might not make a difference in patient adherence. We also present to you a model that allows a healthcare professional to frame the adherence conversation with their patient. We have a number of resources that are available to the healthcare professional. Those are available on our website, www.ipmamed.org. We encourage you to download the Patient Adherence Toolkit. In it, you will find resources that help challenge physicians and their office staff to look at how they might systematically assess adherence as they are both writing the initial prescription as well as following up with the patient. We've got some challenging cases in there to use as discussion points with physicians and their staff to look at how you might change framing the question. We encourage you to contact any of us to get some additional information and to read the full needs assessment, which includes all of the points that are made here, as well as some additional tools that you can use within your own practice or as you talk to other physicians. We hope you enjoy the other 3 chapters of this video series and find ways that you can work on improving patient adherence within your practice.